All right. Good afternoon, everybody. This is Dr. Micah Allen of Essential Natural Health. I have today with me Miss Adia Callahan. I had you listed as Coach Callahan, but Adia is wonderful. She's a great friend of mine from the Pacific Northwest. We've known each other for close to a decade now, and she's doing some wonderful work out, like I said, in the Seattle area. And I'm really delighted to have her on with me today because we're going to be talking about some ways that you can help with
Mhm.
maintaining your weight, but also helping alongside that to decrease your blood pressure over time. So, Adia, can you take just a few moments to, just introduce yourself, tell us a little bit more about what you do, what you offer, and the great work that you're doing?
Hi, Dr. Micah. Welcome to us. Hey, it's good to see you again, and thank you for having me on your show. Again, my name is Adia Callahan. I am a wellness coach, health and wellness coach. I have my business, See Me Wellness, and we work with typically women of color to help make wellness their priority. And what we want to do and emphasize is that you don't have to go at it alone to think about wellness as more of a um, community based type of activity, meaning your wellness is important to us as the community. Therefore, doing it with the community is just as important, if not more so, than trying to do it alone by yourself. And we want to really hit that point and make sure that that's something that's driven in. And we're here to support that.
Awesome. Awesome. So, See Me Wellness, Essential Natural Health, obviously a lot of cohesive goals, and
Hmm.
our audiences are very similar. So I thought it would be wonderful to have you on specifically to talk about weight management, exercise, and why that's important, and how easily we can implement, some of the strategies we're going to talk about today in
Yeah.
order to effectively manage your blood pressure. So,
Yeah.
um, just a few statistics, some data regarding decreasing weight and how it can affect your blood pressure. And so, when we're able to decrease our weight by at least 20 pounds, we're able to decrease our systolic, which is our top number when we're looking at that blood pressure. We're able to decrease that top number by 5 to 20 points. And so, again, a 20-pound weight loss can significantly reduce, say, if you're hypertensive with 160 or 140 over 80, and you're able to lose 20 pounds, that could get you in a normal range,
Hmm.
potentially. Obviously, there's other factors, but I think that's pretty significant and something, that can be very helpful and implemented today, right?
Right.
So,
Right.
um, I want to give just again our top three, what I say top tier items that we can start and do today to help with managing your blood pressure via weight management strategy. So, the first one that I'll throw out obviously is exercise, right?
Yeah. Yeah.
And so, Adia, can you tell us a little bit about just some strategies that you use in your practice? I know that you're a wellness coach, but you also offer fitness on
Yes.
site and in the Seattle area. So, tell us a little bit more about exercise specifically and why it's so important.
Right. So, Dr. Michael, when you mentioned that 20-pound weight loss, it's important to understand that to get to that weight loss, there's two ways you can basically do that. There's the dietary management and or to your point, exercise. And because exercise versus the dietary, if you look at them separately, the exercise over dietary management will offer you more effectiveness for blood pressure management because the exercise is going to work the internal body more so than the dietary. Meaning, when you're utilizing your body, making it move, then you're also making the blood move. Also, you're working the arteries, and that's where your blood pressure and the heart. So that's what the 3 points that you're really working. You're making the body move, i.e., you're making the blood move, i.e., you're making the heart work more, making it stronger. And then also it's actually affecting the arteries. And so when you're putting those components together, that by definition is what helps the blood pressure, the natural way of managing your blood pressure. And so when I'm working with clients and they're being given the directive from a medical professional such as yourself to see if they can manage their blood pressure before, especially before drugs are introduced into their routine. What we really try to talk about is utilizing their strengths um, as an individual in working out an exercise regimen or routine. So finding things they enjoy doing already and then taking that to the next level to help manage their blood pressure. When in doubt, walk it out, right?
Yes.
Walking is great for all of us. I'm over 40, so I'm in that middle age range. And walking for me is not only great for my blood pressure, but it's great for my stress reliever. It's walking is one of those big bangs for your bucks. Why it's so good for all of us is one is most of the time it's free. Two is very accessible for many people, and then three you get to give and take. Like you have a lot of autonomy to it. So the days where you could go all out and you could kick it up and you get that heart rate really up there and you could really give more of a cardiovascular workout, you could do that. And on the days where you need to take it easy, maybe you need to listen to your body a little bit more, you could do that as well. So you have a lot of autonomy when it comes to working out, and then it's low impact. So maybe if you have some issues going on with your body where running may not be accessible to you, certain kind of movement patterns may not be accessible to you, because we most of us move for our everyday living, walking mimics that. And then that way you get to get that onto a whole nother level, plus you still manage your blood pressure. My husband, he'll probably be mad that I put him out, blast him out like this, but he's in that category where he's just at that cusp. So he's been given that directive, he needs to be paying attention, and he took that initiative, and he's been doing a very good job of incorporating walking as one of his exercise modalities, and starting to see a very significant change in his blood pressure.
Wonderful, wonderful. And I love that you brought up the point around accessibility, because sometimes, I know in the clinic, we'll talk about, okay, you need to move your body a little bit more, a minimum of 30 minutes, 5 days a week, so that we can get that targeted 150 minutes a week.
Mm-hmm.
And the clients are like, well, I don't have a gym membership, or,
Mm-hmm.
if they have pain, like low back pain, it may be more difficult to get out and ride a bike or to lift heavy weights. But walking and swimming swimming sometimes can be less accessible, but walking for sure, you can get out and pace yourself, and still get those gains that we were talking about earlier regarding reducing your blood pressure. So kudos to your hubby for taking the first steps.
He's doing good.
Oh yeah, absolutely, absolutely. And then with walking and exercise too, we're gonna increase that natural endorphin production. So when we talk about mood, especially everything that we've gone through collectively over the last 2.5 years, that walking is not only going to be beneficial for our cardiovascular health, but when we look at the mental emotional components,
Yes.
the natural endorphin production is bar none. So
Yes.
so that's our first of three recommendations or suggestions around weight management tactics. So, and we kind of segued into it, but decreasing stress. And
Yes.
so when we have less stress, we're going to produce less cortisol. And we know that cortisol is what we consider our fight or flight hormone, right?
Mm-hmm.
And
Mm-hmm.
so when we're producing cortisol, we're going to increase the likelihood of us having an elevated blood pressure, but we're also going to increase the likelihood of us maintaining or holding on to that increased waistband, right?
Yes. Yes.
Mainly because we're going to be storing a lot more fat in that area, and it's a mechanism by the body to protect itself.
Right. And you
So,
could
yeah.
tell
Yeah.
You can tell, right? Sorry to interrupt, but
Yep.
this is a very hot topic with some of my clients, especially clients who have stressful jobs, stressful
Mhm.
living situations, and they come in tight,
Right.
right? And I'm sure you can talk to the same, right? You can tell those clients they come in tight, meaning their muscles are stiff, they walk stiff, and to go along with it, they typically, male or female, have a that belly, and it's a different type of belly. It's firm, um,
Right.
right? It's firm and it protrudes out more than to the side,
Right.
and that's usually a giveaway, at least for me as a non-medical professional, but as a health professional, that they may have some stress going on that's continuous, and that's the difference. We all have stress, but that continuous stress where your body doesn't get a chance to recover. Um, you and I know both that a month ago, 2 months ago today, I was in the hospital. I had I'm recovering from my own medical issues, and the doctors were, when they couldn't identify exactly what was going on, they said it was stress related. And I put a big pause on that because I worked very hard to manage my stress in a way that is to try not to make it ongoing. So as stress comes up, I try my best. I see a counselor, I try to address things, I exercise so it doesn't stay continuous because stress internally damages the body, not just the mind. It actually goes in. In my mind, I think about little razor blades. It goes in and it does things into our organs. It does things to our veins or arteries. Like it does some real work and negative work into our body. And for that reason, we all know this sensation of at times where you get stressed out and your heart rate increases. And so you can feel your heart going boom, 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 boom. Or you may feel that blood pressure in your head and it goes boom, 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 boom. If you feel that, there's a chance that your body had already been experiencing and it's experienced that over and over and it's jacking your blood pressure up continuously. And then your body gets to a point that says, I guess this is just where we are supposed to be at. But if we could get you to the point, or you get yourself to the point where you can alleviate the stress, or when you do get into a stressful situation, that you have techniques to reduce or get out of that, then give your body a chance to decrease, to alleviate. And what it does is just like a bank account. You want to make the money, you want to save the money, you have to spend some, but you want to have these nice consistence in and out versus having straight up and down or these increased spikes that really does a lot of damage. And you don't want that for your bank account, but you don't want that for your body as well. I hope that
Absolutely.
makes sense, but people usually understand money better.
Right. Right. So make it plain, right? So it's
Yeah.
understandable. Yeah, you're absolutely right. I mean, we've heard, you can't pour from an empty cup, but the bank account analogy is absolutely spot on. So yeah, so far we've talked about exercising, a minimum of 150 minutes a week, and you can break that up however you like. If you
Yep.
want to do 10 minutes at a time, whatever you need to do to get it done, is all right with us. And then decreasing overall stress. And we've said before that exercise is a great stress reducer in addition to other modalities as well. And then I wanted to just add just decreasing overall alcohol intake. Again, over the last 2.5 years, because things have been so stressful, because people have been home more than typical,
Hmm.
I've seen in my office a huge uptick in alcohol consumption just with people trying to regulate themselves. But the difficult part, obviously, there's a lot of concerns around overconsumption of alcohol. But as it relates to blood vessel integrity, hypertension, what happens is that alcohol is converted to sugar,
Yeah.
and eventually that sugar is then stored as fat, again, usually in the abdominal region. But it also can damage the blood vessels. So if you are going to be tending to have a higher blood sugar, we will eventually start to see a breakdown in vessel integrity and therefore hardening of vessels, We can see someone move to something called metabolic syndrome, which is pre-diabetes. And, the triad of diabetes, hypertension, and high cholesterol is not a great look, especially as it relates to cardiovascular health. So if you can, I always like to have clients start things in moderation. So I say if you can reduce your alcohol intake by 50%, that's a start, and then we can work from there to make the appropriate adjustment. So, any insight on alcohol consumption from you, Adia, or did you want to speak a little bit more to? I think nutrition is where you wanted to pivot.
Right, because I don't work with my clients directly on the nutrition. That's not my expertise per se. But what I do say is, it's okay. We're supposed to eat. We're supposed to enjoy. But to your point, it's all about moderation. You and I both are from the South. I'm from Mississippi. I know how to eat fried food very well. Like I can eat good fried food, and I can do it good. But I don't do it every day, and I utilize it more as a treat than an everyday meal.
Right,
That way, it does one or two things. It allows me to eat it when I do consume fried food. I can do what I need to do with it, right? It's because I don't do it all the time. But secondly, it gives me the opportunity to try other things, and so there's no, what the real thing is we don't need a tipsy Tuesday and a wind down Wednesday,
got it.
right?
Yes,
Start off with maybe one or the other, and then try something different on the opposite day. And so it's not about I I've I've seen you as a patient, and you said it's the one thing it took away from you is it's not about taking away, but it's what can we add.
right,
And so I think that's one important thing that we should remind people is we're not trying to take away anything, but we're trying to add longevity to your life overall and longevity and wellness. So being well, and
right,
it's not a sexy look. To your point, it's not a sexy look to um, be in this body and not be healthy and feel good in the body that you have. None of
right.
us want that, and we don't want it for any of us. So overall, we just want you to feel good and move good and have a healthier life in this body that you're being given.
Awesome, awesome. Well, this has been amazing. It's always, like I said, a pleasure to speak with you, as professionals, friends. Swapping notes via text message is always a joy. You have an amazing light and aura about you and yourself. So it's been an honor. And again, if you guys want to learn more information about what Coach Adia has to offer, her program, please do check out her website, seemewellness.com, for more information. And definitely, if you're in Seattle, any on-site opportunities that you have to see Adia, please don't hesitate to reach out to her. And then, yeah, Adia, can you tell us more about if there are other channels or other media that we need to pinpoint for folks to see you, like your Instagram, your Facebook, or is all of your info on the website?
Monday through Thursday, we offer virtual classes. So that's on the website, Saturdays as well. So if you're interested in moving with us, we do offer that. And then we are starting to build out that we're really trying to work on building out more local and national events. We are starting out. We just had our first wellness retreat, and so we're building out. She Does Support, which is offering those ladies in our communities the opportunity to reach for their goals, their wellness goals. So if that's something you're interested in, please reach out to me. And I want to say thank you again to Dr. Micah and Essential, because it's been again, 2 months ago, I was reaching out to Dr. Micah for help. So
Yes.
it's been something that I needed myself. So thank you. These platforms and having you in the community is truly essential. So thank you so much.
Thank you, Adia. And then, just to give some more information about the Legacy program, and we're doing our best to drop in at least every other week. We were back to back this past week because we were out prior to, but The Legacy program is a program that is tailored specifically for helping you figure out the root cause of your high blood pressure, and working with me one on one, and also having access to a program that includes diet, nutrition, self care management, meditation. All of that information is included in the program. So if you're interested in that and looking forward to getting some clear answers and getting some wonderful results, I'd love to have you drop in and set up a clarity call. And you can do that through my website, which is drmicaallen.com. And you just look for the Legacy Program tab. And we, like I said, love to have you join. And just a few people who popped in. I just want to thank you guys for stopping over. We had Cheryl. Cheryl says that she's a health and wellness coach in Rhode Island. And again, just wanting to say thanks for joining in. And she's doing diabetes prevention programming.
Oh, yeah.
So that's really important. Again, we haven't talked about diabetes in extensive amounts of time, but we did touch on it a little bit here, but absolutely important for high blood pressure and cardiovascular health. So thank you, Cheryl, for joining. And we also had William on live. And so thanks, William, for joining with us from LinkedIn. Always great to have you, and look forward to sharing with you all again in a couple weeks. And until then, be well. And yeah, if you have any comments on the replay, drop them in the comment section. Myself and Adia will try our best to get to them and get them answered. But until then, you guys take care and be well.